Welcome to the University of California, San Francisco Sports Medicine Podcast featuring Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you.
All right. Welcome, everyone, to our UCSF Sports Medicine Podcast, 6 to 8 weeks with myself, Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown. Today, we're going to break down some of the basics of injuries. There are a lot of terms that people hear, such as strain and sprain, ligament and tendon. And I think it's important for people to understand the vocabulary behind the injuries that we see. So maybe first, Brian, I'll start out with you in terms of defining generally what's a ligament and what's a tendon. Like, what are the different things that can get injured?
Sure. So I think, first of all, these are the most common injuries that sports medicine people, especially people on the sideline, end up seeing. A tendon is a connection from a muscle to bone. So essentially, muscle is otherwise going to be floating. It has other small attachments, but on one side, it usually has a shorter tendon, which connects the muscle tendon or the muscle down to bone. And then on the other side, it usually has a longer tendon. And one way to think about it around the shoulder can be your biceps. So you can feel your biceps in your arm, and you can feel something down by your elbow that feels like it's coming off your biceps. That's a tendon. And then you actually have two up on the top that go up around the shoulder. A ligament is a little bit different. A ligament, for the most part, is something that connects two bones, oftentimes in some conditions inside a joint. So the classic ones we think about are ones around the knee. So we think about ACL, anterior cruciate ligament, MCL, medial collateral ligament. Around the shoulder, those end up being things that cause shoulder separation. So they come from your coracoid, which is a little bone that you can feel in the front of your shoulder, up to your clavicle and hold your collarbone down. And when that gets injured, those get stretched out.
All right. Maybe a follow-up question for you, Drew. What's a muscle strain?
So muscle strain is an injury to the muscle fibers. So that tissue, whenever it's stretched beyond what it is capable of handling, the tissue gets inflamed, directly injured. And usually we think of muscle strains where that muscle is not like completely severed or completely cut, but just stretched. And muscle is great because it has kind of intrinsic healing capacity. So a lot of times those muscle strains, that's why people can heal from them, and without any kind of surgical treatment, without a lot of other directed treatment, is that muscle is able to kind of take care of itself, heal itself, and get better with some time.
So Drew, you said it often heals by itself, and as our semi-expert in imaging, what's the value of getting MRIs? We see a lot of times athletes go in and they say, oh, Draymond's got a grade 1 muscle strain of his calf. What does that mean? And does that actually help in terms of getting people back?
Yeah, so the grading that people talk about is the severity of that strain. And generally like a 1, 2, 3, with 1 being the most mild, 3 being the most severe, and then 3 being thought of as just a complete tear of the muscle. And for most of us, I would say that slight distinctions in the severity of injury probably don't matter that much. When you're talking about Draymond, though, it could be the difference between coming back in like 7 days versus 14. And, there's a lot of planning that goes on as to, when he might recover, what the, roster is going to look like, game plan, everything like that. So, for a lot of people, a couple days may not be consequential, but if you're looking at an NBA schedule, that does come into play.
And Brian, what are the general treatments for these type of injuries? I mean, everyone kind of knows about ice and, rest and maybe anti-inflammatories, but what are some of the more specific things you can tell patients when they have these injuries?
Rest, ice, anti-inflammatories. I mean, it's a good question, because I think oftentimes when we think, oh, it's just a strain, we should be able to get people back quickly. And the reality is these take a long time to get better. So for those of us that are older, we've probably all had some sort of muscle strain. The common ones you think about are a calf strain, where you actually get a partial injury to the medial part of your calf. Raise your hand if you have one right now. Awesome. Drew, welcome soon. Or a hamstring strain. And if you think about athletes that have been out, these are 4 to 6 week injuries. Before athletes are often even asked to test the muscle. And that's because you're relying on the entire power of the muscle that's now injured, and it's got inflammation, it's got blood within the muscle. And every time you try to go back too quickly, you're just going to re-injure yourself. So in terms of treatment, the most important thing early on is rest, compression, and some sort of ability to decrease inflammation. And that can be ice, that can be ibuprofen. Your body has a tremendous anti-inflammatory response, and you want some of it, but you don't want all of it. When we look at ways to make things go faster, the reality is we haven't really found something. So early on, there was a really nice study on NFL players where they looked at doing a steroid injection into athletes that had bleeding around more severe muscle strains. And it showed that may get them back a little bit faster, but the reality was it probably saved you a game. And it really didn't seem to make a big difference in terms of function. When we look at biologics, things that we talk about injecting either from your own body, like PRP or stem cells, those two haven't really been shown to speed up recovery. And I think part of it is every athlete's different. Every strain is a little bit different. So it's hard to say, well, this athlete got back in 1 week, but the classic one, Matt Kemp for the Dodgers, seemed to never get back from his hamstring strains consistently. So being able to judge what's actually going to make people better is really hard to do. Now, we talk about this being something that happens in professional athletes, sometimes college athletes. Nirav, do you see this in kids?
Typically you don't see it as much in kids, and a lot of that has to do with the fact that younger people, because they're growing, the weak spot is kind of where the muscle attaches to the bone around the growth plates, which are basically areas where the bone's growing. So for a lot of these kids, what ends up happening is the bones will grow faster than the muscles and tendons and ligaments can kind of keep up. And as a result, what ends up happening, there's a lot of inflammation at that junction. So for kids, when they come in, they say, oh, look, I might have torn my quad, or, I could have torn my calf. Where they're actually sore is down where the muscle attaches to the bone at the growth plate area, and they're going to have much more tenderness on the bone as opposed to the actual muscle itself. So yeah, we do see it. I mean, kids are generally more prone to get some soreness during the growth spurts, but the actual injury usually occurs more at the bony area, and that's just a relation to kind of where they are in terms of their growth cycle. Right. Maybe question for you, Drew. What's a sprain? Because people get confused, sprain, ligament, tendon. What exactly is a sprain?
Yeah, so with a sprain, usually talking about ligaments, and then it's a stretch of that structure. So, you can think of a ligament like a rope, essentially, that is connecting the two bones together. And then if you pull hard enough, you'll stretch that structure. And then, we'll also talk about, grading of sprains in the same sense, like a 1, 2, 3, with 3 being the most severe and being a complete rupture. So that's where you've stretched it far enough that now that'll completely pull it apart. And, it's important to, think about that degree of injury, because if it's a low grade injury where you've just kind of stretched the fibers a bit, but, that structure is still intact, may be able to heal on its own, may not compromise the long-term function. And then if it's completely torn apart, for some ligaments, that healing capacity is quite a bit different.
And is there a difference, Drew, between ligaments that are located inside a joint versus ligaments that are outside of a joint in terms of ones that can heal?
Yeah, we especially think that's true at the knee. So the ACL is one example that, that ligament is just right in the middle of the knee joint. And then the MCL is outside of the joint itself. And the differentiation, we think it's important because the healing capacity. So in the joint, every joint has like a normal amount of fluid in it. And we think that may get in the way of these structures healing, or something else, impacts that healing capacity. So even a higher grade partial injury to the ACL may not have that same regenerative capacity. And then an MCL injury, those really reliably can heal very well, even some grade 3 injuries, more severe injuries to the MCL. And we think just being outside the knee joint, that has a better propensity to heal on its own without some kind of surgery to intervene.
Just kind of along those lines, you talked about things ruptured, kind of going back to our strain, the first topic we talked about. A lot of times we'll see ruptures at the tendon level versus in the muscle. Like a lot of times you got your muscle that generates the power, and the tendon where it attaches to bone. Brian, why are actual tendon ruptures such a big deal as opposed to a little strain or, in the muscle itself.
Yeah. So I think even though it's less common for a lot of athletic injuries, it becomes more common as patients get older, and we get ruptures of the tendon where it attaches to bone, which is essentially a complete detachment of the muscle to what it needs to be attached to in order to work. So classic ones that we see in athletes are patellar and quad tendon ruptures. So that essentially means your entire quadriceps mechanism isn't going to be working. In older patients, these are rotator cuff tears, especially after a fall where you can avulse or tear your entire rotator cuff. It doesn't mean every rotator cuff injury needs surgery. Oftentimes, these are more degenerative processes that happen slowly. But if you have an acute injury where you rupture the entire tendon off the bone, that's something that most likely is going to need surgery. And I think one reason why I think it's important sometimes to get imaging is to figure that out. So oftentimes we'll see patients that are really swollen around a hamstring injury. We can't quite tell if it's a proximal hamstring injury or where the tendon comes off bone. And the reason why we want to get imaging is one of them may require surgery and one just requires rest.
And maybe Drew, kind of on the other topic, you talked about ligaments. A lot of people at times, these ligaments, as you mentioned, will be ruptured. When do you decide to repair a ligament versus when you actually, quote unquote, replace it or reconstruct it? I think a lot of people hear, ACL and they say, oh, I got my ACL repaired. Well, actually, no, you got it reconstructed. So what helps you determine whether you're going to sew it back together or put a new one in?
Yeah, a lot of it depends on which ligament we're talking about first off, and then secondarily, what the tissue quality looks like, and kind of our judgment of how likely that structure is to heal if we repair it. So with the ACL, the standard for treatment is essentially the ACL reconstruction. So where we're putting in a tendon to function as a new ligament, and then try and get that to heal, remodel, and then the knee's stable again. There's some recent interest in repairing it, but historically that really hasn't worked well. So basically, if you had ACL surgery, it was almost certainly an ACL reconstruction. And then things like the MCL, if somebody has ongoing instability, the MCL just didn't heal, a lot of times we can just repair it. Like the ligament is still, the tissue's good. We can just sew it back down to where it should be and get it to heal. And there's a few others around the knee that, kind of have that capacity as well.
Right. And, one of the things that I think people get confused a lot about are these injuries that kind of occur around the body, and they're not sure whether it's a sprain, whether it's a strain. They hear, announcers talking a bit about it on football. And one of those, or even basketball, one of those is a shoulder separation, right? And a lot of people are like, is it a ligament? Is it a muscle? Is it a tendon? Is their shoulder falling off? What exactly is a shoulder separation? I mean, we're just, at least for us in the Bay Area, finishing up the football season. What's involved and what's the pathology behind it, Brian?
Yeah, so I just learned this. Turns out a shoulder separation is different than a shoulder dislocation. But I think in terms of figuring this out, I probably was partially through my orthopedic residency before I understood that a shoulder dislocation is when the ball of the shoulder comes out of the socket. And that's an entirely different mechanism than when people have a shoulder separation. And the reason why we're talking about it today is because with shoulder sprains, that's essentially a sprain or rupture of the ligaments that hold your collarbone down. So the idea is that you get a shoulder separation where your clavicle rises up, or at least the ligaments get injured and stretch out. And I think it's a really good example of how the degree of severity dictates whether or not you can play. And I remember way back, there were two quarterbacks in 2007 that got injured. One was Alex Smith and one was Eli Manning. Both of them had a shoulder separation of some sort, and they went on to two very different years. Alex Smith ended up with the year with surgery, and Eli Manning didn't even miss a game, and they ended up going on and beating the Patriots. It doesn't mean that Eli is tougher. He was very tough guy, definitely had to play through pain, but in the end, it's the degree of severity. So if you have a more advanced AC separation where the ligaments are more torn, your collarbone sits too high up, and that's something you're going to need surgery, especially if you're going to throw. It also means with lower grade sprains, we usually treat this differently than we do with muscle tendon injuries. With a muscle tendon injury, it's rest. With a shoulder sprain or a mild shoulder separation, we can actually let athletes play as long as they feel like they can protect themselves and play to the quality that they feel like they're able to. So one thing that's probably going to come up sometime in the next few weeks is how injured was Jimmy G's shoulder? Well, it probably wasn't normal. It probably hurt every time he landed on it, probably affected his mechanics a little bit. But in the end, it's ultimately a decision between the medical staff and the athlete, whether or not people can play with these more mild AC separations.
And Drew, question for you. I think a lot of people also hear with shoulder separations, they'll say, oh, is it stinger? But no one really actually knows what a stinger is. And sometimes athletes will come and kind of be holding their arm down like that. What exactly is a stinger? And is it similar to a separation? What exactly is going on?
Yeah, so a stinger, it's a stretch of the nerves around the shoulder. So all the nerves to the arm, they exit from the neck and then travel around the shoulder and then down towards the hand. And what happens with tackling sometimes is your head gets forced one way and then just stretches the nerves. And so that gives you like a shooting pain down the arm, can lead to like a dead arm type feeling, just where, like the nerves are just kind of temporarily stretched, injured. And it can be a really scary injury, especially for, the player experiencing it, because, all of a sudden they've got this pain down the arm doesn't work. A lot of times it will just resolve usually pretty quickly. But if it keeps happening, it can be suggestive that there's something more serious going on in the neck. So I know when we're on the sideline, our primary concern is always like, was there a neck injury, and making sure that we rule that out. So taking these very seriously to make sure there's not, an associated fracture or something else that could really put the player at risk. And then if it is somebody that, keeps having these injuries, there might also be something, congenital or something, about their neck that just is making them more likely to experience these, and probably also needs to have treatment for that.
Great. Well, obviously we covered a lot of broad range of topics today. So once again, thanks everyone for joining our UCSF Sports Medicine podcast, 6 to 8 weeks. And we look forward to, for all of you listening to our episodes coming up. Thank you.